Hi, I'm Dr. David Zahalik of Main Street Medical Care, and this video is a carryover from the previous one and want to talk about the treatment now of allergies, which again is on a lot of people's mind here in the Louisville area and Dallas-Fort Worth in general. Now, when you're choosing treatment, whether it's with your doctor at the office or when you're just going to the drugstore and looking over the counter, there's a couple of principles that are worth considering. Number one is we just want to use the medication that'll control your symptoms with the least amount of side effect and cost. And that includes things like choosing over the counter when it works over prescription. It's a good idea to manage your resources well so you don't have to spend more than you have to. And try to use medications that are topical, eye drops, nasal sprays, etc., that will manage your symptoms without putting a drug into your central nervous system or into your bloodstream. So in general, that's what we're shooting for. And for the majority of patients, those simpler treatments work very well. Some people need the bigger drugs, but always try and make it as simple as possible is one of the treatment principles. So you know the medications involved. I mean, there's antihistamines because, as we said in the last video, the first part of an allergic response is the histamine secretion. But, I mean, let's think about the antihistamines for a minute. Certain things can happen from using an antihistamine that are not altogether good, not the least of which is a car accident, a DUI, which you can get if you're affected by your prescription or non-prescription medication, the same as if you were impaired from alcohol. Decreased performance at work and athletically, either in your workout or on the playing field, and worsening of sleep apnea if you have that. So those are things we have to consider when we, look towards using antihistamines to treat your problem. Now, again, if you're using an antihistamine-based nasal spray, that should be less of an issue. Although it still can be a little bit, but it's a lot less than if you're taking it as a pill. And there are, of course, antihistamine eye drops, nasal sprays, and pills. And you can get an antihistamine shot too if you're having trouble with a really bad hives reaction. Sometimes you have to get a shot of Benadryl, or if you're having anaphylaxis, you may have to get it in a shot as well. Now, when people think about antihistamines, they think about basically the most commonly bought over-the-counter drugs, which are Claritin, Zyrtec, and Allegra. Allegra just recently went over the counter here. Generally speaking, Claritin is less effective than Allegra and Zyrtec, but it's also less sedating. And these are considered newer generation antihistamines because they last longer. They usually last about 24 hours, and they cause a lot less fatigue. The older generation antihistamines are things like Benadryl, which will last about 6 to 8 hours and cause quite a bit of fatigue. Sometimes I prescribe a drug called Lodrain, which is kind of in the middle. It's a first-generation antihistamine, but it does last all day, and it's not as sedating as Benadryl. But we try and look at those categories as to how we're going to prescribe the oral form of antihistamine. Now, we said that in the last video, we said that initially an allergic response is due to histamine release, but then 4 to 24 hours later, your body makes leukotrienes, and that may be the driving force of your allergies. And so drugs like Singulair works to treat the leukotriene response, and also other drugs like methscopolamine and scopolamine, which you find in products like Rescon and Allerex, can be very effective if you have a late phase response predominantly. And a lot of people who have that leukotriene response complain mainly about blockage, about feeling blocked rather than feeling like their nose is running or itching. That's a kind of a one way to kind of gauge it, but sometimes you just have to try the medicine to see if it works. Now, when I give Singulair to patients, sometimes they say this works great, and about an equal amount of time in my experience, they say this didn't work for me at all. So it's one of those things that you kind of just try when your other medication is not working out. It's also indicated for the treatment of asthma. So if someone has allergies and asthma, Singulair can be definitely worth considering, especially if they're not getting good control with their first line approach. And then in terms of things like Allerex and Rescon, they're usually given in combination because they have been associated with some drowsiness, but again, combinations will help to balance and limit that. And these kind of drugs are not available in a topical form; they're just taken orally. Now, decongestants would be things like Sudafed and anything that ends with D, so like Zyrtec D, Claritin D, Allegra D. The D stands for decongestant. And you have to watch with any kind of decongestant medication its effect on blood pressure and heart rate. So if you're on blood pressure medications, maybe the Sudafed is not the best choice for you. Again, that has to be taken into what has to be taken into account is your overall state of health. And sometimes it's very effective to talk to your doctor about this to get the right approach for you. Now, another class of drugs that we use are steroids. Steroids can be given either as a spray, most commonly as a nasal spray, or it can be given as something that will enter the bloodstream, either a pill like the Medrol dose pack or prednisone, or in a shot form. The shot form is usually, depending on which type that they choose, is a shorter acting thing where it may be in your body for just a couple of days, whereas if you're taking a steroid pack, usually you're taking it for 5 days and it's going to be in your system for about that long. You have to watch the systemic effect of steroids. There is some decrease in bone density associated with recurrent steroid use. It'll definitely increase your hunger, and if you're diabetic, it may increase your blood sugar. Now, steroids can be very effective, again, in somebody who's got a flare of their allergies and asthma, because it'll treat both. And what it'll do is help to decrease the tissue swelling. And sometimes the tissue is so swollen, I'll look in someone's nose and it's so tight in there that's sometimes will be the only thing that'll work. But again, it's not something that we just routinely give to everybody with allergies. It's kind of a more advanced approach than just the basic approach. So there's a place for it, but certainly not with everybody. Now, it would be remiss not to mention the allergy shots or hyposensitization. And allergy shots are similar to a vaccine. So we're introducing a little bit of what you're allergic to, say grass pollen, into your system a little bit at a time so your body can get used to it and can function that way without so much of an antibody response. It's a long-term and costly approach, but sometimes it's exactly what's needed. So the first 4 to 6 months, you have to come every week or twice a week to get the shots to build up to a maintenance dose. Again, if your allergist gave you the full strength of what they could give you, you might have a very severe reaction. So they have to give you a little bit and build you up steadily. So it's about 4 to 6 months of once or twice a week to build up to maintenance. And then there's about another 4 to 6 months where you take shots every 2 weeks or every month to kind of, get a better response and perfect that response. There is no, one single approach to the schedule here. There's no real way to know the optimal duration of therapy except to just try it. And the duration of how long it'll give you benefit for is hard to predict. Some people will get their allergies back a few years later, but some people will have lifelong improvement from shots. So the people who allergy shots work well in are people who have allergies and asthma, or they've tried the regular medications and they get no benefit from that. So those people should think about it. If you have food allergies, or if you have a skin allergy, like a latex allergy or a medication allergy, they're not quite as effective in those cases. And you have to be cautious about using allergy shots in someone with, for example, severe or unstable asthma, or immune system problems like MS or thyroid disease, or someone who's taking a beta blocker type medication, for example, for hypertension. They have to be used with some caution and some finesse there. And then the final thing I want to mention, because it can be life-saving for allergies, is the EpiPen. And if you're someone who, when they get a bee sting, their whole face swells up and their airway swells up, keeping an EpiPen with you wherever you go, basically one at your home and one wherever you go, can be a life-saving measure. And that's not the time that you want to be calling your pharmacy for a refill on the EpiPen. You have to have it right there handy with you. So most people don't need it, but for those who need it, they must have it handy at all times, and work with your doctor to make sure that you've got that with you with no difficulty in getting to it. So that's just a quick review of treatment of allergies. I hope your allergies are under control this season, and if you have any questions, call our office. Thank you.